coming to you from Warrior Way, Team Kaiki Jiu-Jitsu. I just had a lower back injury here about a week ago and developed this flow for a joint mobility warm-up to take your low back through before you're doing your workout, maybe as a daily rehab for your back. Really get you going back to being able to get back on the mat as soon as possible. So I hope you'll like it. If you're doing this on your own, you'll need to modify this in each of the poses based on how you're feeling as far as how you want to go. We're not holding the poses too long. We're trying to actually move into the pose and keep some flow going through this. So we'll start here just in child's pose, stretching out, feeling our lower back, starting to deepen our breath. And we're from child's pose onto our knees, and then just hollowing our back out here and rounding our back. Kind of this cat-cow posture. Kneeling on our toes, feeling where our back stood this morning. So inhaling as we're looking up, filling the chest. Exhaling as we're rounding the back. Just feel what's going on there, wherever your area of issue is. Then change a little bit here, side to side, making our spine kind of into a C shape, opening our ribs. Again, exhaling as you crunch to the side, inhale back to the center. Good, coming up on your toes, first time through with our knees together, making these knee circles. As you come back towards the back, you're seeing how close you can come to flat-footed, trying to bring your knees outside your elbows. Switch directions. This is now bringing some rotational movement into that lower spine. Good. Stepping forward with the right foot. Got our ankle right below our knee right below our hip. I'm going to turn to the side so you can go see this a little bit better. So two 90-degree angles. Very important here. We're going to stretch the front of this hip flexor, preload by tilting the pelvis under, and then just slightly slide forward. You'll feel a really good stretch here across the front hip flexor, quadricep. And for our back, we're just going to add a twist over our right shoulder, twisting towards the leg that's out front. You can gently use your hand, just an assist. Make sure you sit up nice and tall. See how this feels. Keep breathing deeply. Good, coming back from here. Set that back leg under, coming to a shin box. From this shin box, we're just going to do some twists here. So twisting to the left first. Switching our legs. It's okay to use your hands as a kickstand right now. For me, that's what I need to do with where my back is for this switch. Sitting up tall. You can use the kickstand as I am. Hand comes across, just help you twist. Make sure you're sitting tall, keeping that spine long. Bring some rotation now into the spine. Checking the nose to see what's here's next. Good. Now we're going to move to just some hip heights here, staying from the shin box. Lifting up, driving those hips forward. Good. From here, we're going to add the most dynamic one. This one, if your back's in a little bit better shape, you can really try with some dynamic movement. So from here, from the hip height, we're to come down, marry our elbow into our hip, lower ourselves down with our guards in tight, come up into our bridge position, holding our hips up, bridge over the opposite shoulder, hips remain up, coming down, marrying elbow back to hip, coming back up, hip heights. Let's do this a few times. Take this one easy. If you've had an injury, right now this is the one for me. It's quite tender. Inhale, lift that up. Keep those hips up until you're ready to come back up. Good. Coming back onto the knees. Just do some seated. We're actually rounding our back here. Just to finally loosen up here, just pelvic tilts in the seated position. And coming up on your knees, be careful with this one. Again, this one's going to put a little bit more, need a little more muscle to stabilize the spine. Just feel how this feels opening to the side. Exhale. Inhale up and just exhale, relax in. This may not work for you if you had a more serious injury. Open the arms up. Come to kneeling. Place the back of your right hand to wherever you can. For me, it's my low back, so I'm placing that kind of near my kidney on the left side. Front hand in the front. We just want to breathe into that. So close your eyes. Take deep inhales in the belly, and then just exhale slowly through the mouth. Make sure you're breathing deeply enough that you can actually feel your back expand and press into that back hand. Bring your breath right into that area that you need to heal. Take 5 to 10 deep breaths and just set, just for a few moments, maybe a minute or two, and just feel the energy moving in that area that you've been healing this morning. Thank you for moving your body with me, and hopefully your back will recover and you'll be back on the mat and we'll have a great roll together. See you next time.